Hello everybody. Today we are going to discuss about constipation of baby less than 3 months old. I know it is a bit scary when you see a baby is constipated. So we are today going to discuss to increase the awareness about it. So constipation is means when your baby's poo is quite hard and becomes very difficult to pass. So several days without passing poo, very hard palate-like, stool, and there can be, when they're passing, they can be unsettled. So fortunately, most of the time we can easily treat it at home. Um, and of course, if your baby is not constipated, if your baby's stool is not hard and have dirty every 1 or 2 days. There is no normal when it comes how often baby will poo. So breastfed baby rarely get constipated because breast milk contains natural laxative, and they tend to have yellow colored seedy poos, and often they're quite soft. So newborn breastfed babies may poo after every feed. Older breastfed baby may go up to 1 week without pooing. Formula fed baby tend to have bulkier poo and generally go several times a day. And they reduce it as they get older. You will quickly get used to your baby's bowel movement type, and you can know that what is normal for your baby. Now, if you are formula fed, make sure that you use the correct number of scoop of formula to water according to the packaging. So you can see that packaging and use that guide. If it is normal for your baby to strain, look like that they're trying to poo more often. This is not usually signs of constipation, but just them getting used to the feeling of poo and wind forming and moving through the bowel. Now, what causes the constipation in babies? Variety of reason can be constipated, lack of fluid like dehydration, various reasons why your baby may not getting enough fluid, and it could be down to illness, lack of fluid, and that makes your baby's poo more harder and more difficult to push out. So that is one of the things. And now what you should do. In general, babies with constipation can be managed by increasing fluid in their diet. A small number of the baby becomes constipated due to underlying medical condition. So I will tell you, when you will be worried, when you take immediately your baby to healthcare professionals, like red signs, that some of the red signs I'm going to mention to you, like green vomit, like colored like spinachy, or green washing up liquid, or they look very pale, mottled, feed abnormally, and when you feel your baby is very cold. He pauses their breathing lasting for more than 10 seconds, grunting, blue lip, is very stiff, rigid, makes repeated jerky movement of arms and legs and doesn't stop when you hold them, or feet and seizure, is extremely agitated, crying inconsolably despite distraction, confused or become lethargic, difficult to wake, has a rash that does not disappear with pressure or dust test, and under 3 months age, temperature of 38 degree centigrade or 100.4 degree Fahrenheit or above, unless there is some vaccination within 48 hours. Then you have to take your baby to emergency department nearby, and NHS area you can also call 999. Now, if those what I mentioned already is not there, but your baby does not pass fast poo in the first 2 days of life, or not interested in feeding and looks dehydrated like dry mouth, sunken eye, not teared, drowsy, no wet nappy for at least 8 hours, or sunken frontinally, there is soft part in the top of the head, and vomits forcefully, an ongoing vomiting or blood in poo, a very swollen tummy, seems to be very in pain, very much in pain. Any abnormalities in the bottom, there is nothing you can visibly see in the bottom, which is called anus, then you have to immediately ring GP surgery and NHS area 111. If you're not getting any help within 4 hours and everything is worsening, then maybe baby is getting any red symptoms, you go to the emergency. Now, also another is not red flag but amber flag sign is that if weight loss beyond 2 weeks of age, pus looks very pale in color, then it is important to contact the healthcare professional, contact you. So these are about when you will be, contacting for your child. But some of the things that you can manage at home, if none of the above features I told you and continues to feed well, your baby is plenty of wet nappy, waking up and crying regularly for feed, so that is, you can continue to care at home. If you have any time concern about your baby, definitely it is better to talk with health visitor or local pharmacist. Now, some of the thing what you can do for green, everything is fine, but there is constipation. That help to relieve constipation, and lie your baby down and gently move their leg like riding a bicycle, helps in moving and help them. Give them some tummy massage, that also help. If bottle feed, then try giving some extra water, cold boiled sterile, in between the feed. Breastfeed baby don't need them. It should be offered additional breastfeed, that should be okay. Yeah, it can take few days to get moving the things. If do not improve, seek your health visitor or GP or other GP or others to help you. Maybe they will prescribe some laxative. If any, they will check whether there is any medical condition is there. So I think this little will help you to understand the constipation of little babies. We will talk about something different next week. Bye for today.